At this time, I'm checking for any, as I approach the patient, I am checking for any light threats. I don't see any at this time. My impression of the patient is that he is approximately 21 years old, male black, sitting, and he does appear to be conscious. Okay. A was ABPU, alert.
Oh.
Okay, alert. So, at this time, how you doing? My name is John. I'm an EMT. I'm here to help you. What seems to be the problem today?
My chest hurt.
Your chest hurt. Okay, all right. Have you had this pain before?
Yes.
Okay. What's your name?
Renee.
Renee. Where are you?
At home.
You're at home. Okay. Can you tell me this daytime, nighttime?
Daytime.
Okay. So I know at this point that he is alert-oriented times 3. His chief complaint was chest pain. All right. So at this time, Renee's having chest pain. He has had this pain before, but this time I'm going to instruct one of my partners to give him high Tylenol 2 non-rebreather, 15 liters of oxygen. Okay. His airway's open. There's nothing compromising it. So he's talking to me. His airway's packed. I'm going to go ahead and give him oxygen. All right, Renee, do you have any medical history I should know right now? Cardiac? You have asthma. Okay, so cardiac is ruled out, but he does have asthma at this point. Okay, so Renee, my partner's going to go ahead and give you some oxygen. That's going to help you breathe a little better here. So at this time, Renee, I'm going to go ahead and just listen to your lung sounds. Now, what you can do here after you give the oxygen, you expect to see if the chest, if you have bilateral equal expansion of the chest. Okay, take a deep breath. Okay, that's good right there. Okay, so I inspected. I just palpated here. I'm going to auscultate. Just please forward. Take a deep breath. In through your nose, out through your mouth. One more time. Okay. This time I'm checking, because I am doing breathing, so I'm checking for any tracheal deviation or jugular vein extension. Do I have any? None noted? Okay, I'm going to go ahead and continue. I got A out of the way. I'm on B. B, he's got oxygen. He's breathing 22 times a minute. I auscultated. Lung sounds are clear bilaterally. At this point, I have no JVD, or jugular vein distension, right? So, am I done with B? Am I done with B?
Oh, you put the oxygen on, right?
Yeah.
Yeah.
B, I inspected, I auscultated, right? I checked for any jugular vein distension.
No, you forgot to ask if any blood in my stool.
No, I haven't gotten to C yet. So you see how fast B was?
There's no seal and stabilization.
Yeah, there's no seal stabilization. It's not a trauma patient. Okay, so I'm done with B. He's on oxygen. Okay, I know he has asthma history. All right, C, circulation. What am I going to do with C, circulation? There's no obvious bleeding that I can note, so I'm going to go ahead and just go bilateral pulses are present, CTT. Okay, color, nice pink color. All right, temperature. He's cool. He's dry.
Are you supposed to give an exact pulse?
No, you're just making sure that
Is
they're
there.
present bilaterally.
That's both on trauma and this?
Yeah.
You don't have to give an exact pulse at no time?
No, no.
That would be the vital
No.
full set of vitals, no?
Right. When you're taking vitals,
Vitals,
full
right.
set, then you would do your.
Okay.
So, there's no obvious bleeding. Good bilateral radial pulses are present. CTT, I took. Partner, can you obtain a baseline set of vital for me? Sir, within the last 24 hours, did you notice any blood in your stool or in your urine? No? Okay. So that's circulation right there. Okay. Yeah.
If he's having trouble breathing and his problem is that he has asthma, would you give him albuterol
Yeah, you can give him an albuterol treatment, yes.
during LISA?
First, you have to do your sample. You want to confirm that he is an asthma patient.
So you want to get the sample first and then give
Yeah, okay?
Is he already on?
If he confirms that he takes albuterol, and he says to you, I ran out, most of the time that's what happens, they run out. They run out of the albuterol. Okay, so you can, the thing is, if you're a EMS agency, if you're authorized to give the albuterol, you can give. If you're not, then you're not going to give. Okay? Fire department has it. Other EMS agencies, private, don't carry. So all they can give is oxygen. Okay. So we went ahead. We did the scene size up. We did the Lisa. We did the primary assessment, taking the vital signs. So at this time, we're going to make a transport decision. We're going to go ahead and make a decision to load and go. All right. Now, on circulation, if you notice, I did not check for pedal edema. Okay? I did not check to see if his abdomen was distended because asthma. And then I got bilateral lung sounds were clear bilaterally. Okay? If the instructor would have said to me, you have fluids in the lungs, then I would have said to him, well, possibility of left side heart failure, right? Because the left side starts to fail, fluids start to back up into the lungs. If they would have said to me, if you would have said to me cardiac history, then I would have gone and checked also for pedal edema, just in case of right side heart failure. So very important to listen to what the instructor tells you. Okay? So at this time, I've made a transport decision, so I'm going to go ahead and just, again, airway still open, the oxygen still flowing. How's he breathing? Still 22? That's good. I'm just going to double check for any tracheal deviation. Again, jugular vein distension. Take a deep breath here. Okay, out. I'm going to go ahead at this time, auscultate again. How many times? How many? 4. I auscultate 4. Okay? It'll be 1, 2, 3, 4. So I'm working my way down. All right? You can go ahead and just palpate the abdomen. All right? What should I be doing next?
You still in C?
I did A,
B,
B,
C.
C. Check again. Still there?
Are you in the truck now?
Yeah. No, you're just before we can transport you. Okay. So it's like doing a rapid medical assessment. You're just double checking what you did the first time out. Just double checking. What you really have to think about is what type of scenario is this instructor giving me? Am I going to really have to do a detailed exam, focused detailed exam on this patient? Okay. We're going to try to keep it very simple. As long as you follow the steps, and we see that you're following the steps, you're not going to have a problem. Okay. You're either going to have a patient who's a cardiac patient. If you hear cardiac patient, automatically you are going to check for abdominal distension, pedal edema. So, okay. Remember, if the patient unable to answer your simple command, you'll have to add what to it? Recap BTLS. Okay. When you have the patient in the bus, you know that you have to take a full set of vitals. You know you have to do the sample. You know if it's cardiac, respiratory, or abdominal, you know you're going to have to do the OPQRST. All right? And then, after you take care of that, you check the patient again from head to toe. Okay? Medical is simple. It's not like trauma. Okay? Yeah.
John, if it's a cardiac patient and you type a chest pain, do you give him baby aspirin?
Say again?
If you type in, if it's a cardiac patient and you type a chest pain, do you give him baby aspirin?
Well, here's the thing. Again, only if your agency allows you to give the patient baby aspirin. Okay. Fire department, we carry baby aspirin. Private sector, they don't carry baby aspirin. See, so only if an agency allows you to. All right. No, you don't. The instructor's not gonna. Okay. We're not. Listen. They know that you're nervous. Okay. As long as they see that you're following the steps. What I want you to do at home is when you're doing patient assessments, okay, use the practical skill sheet that we're going to test you on, so you can follow the steps. Follow the steps. If you need to know what your critical is, okay, they're not going to give you a hard time. All right. Just remember that when you're doing your detailed physical exam, medical patient, just remember you're going to do sample, OPQRST, full set of vitals. And then you check your intervention, what type of treatment you provided, check your O2, and check the patient, make sure that they're still alert, double check for jugular vein extension, trachea deviation, make sure that you have equal expansion of the chest, and work your way
the
down.
eyes and behind the ears too?
No.
But you check the eyes though, right?
You can check the eyes, yeah. You can check the eyes. If you're going to do a full set of vitals, check the eyes. You can check the eyes. But remember, just think of the scenario that the instructor provides to you, right? Who has their medical? Let me just see the medical for a second. You'll notice on medical